Okay, now let's talk about health. How is it different from wellness and prevention? And it wasn't so long ago that we were looking, we used an objective measure of health where we said it was the absence of disease. Now, 10, 20 years ago we decided this is actually an unsatisfactory definition of health. And we started to use a subjective definition. I'm talking about the World Health Organization as well, right? That became the physical and mental and emotional well-being. Quite a subjective definition, in fact. Yeah. Now, let's have a look. We talk about preventative health. Remember, the clinical arms of Chinese medicine were really obvious to us: acupuncture, herbal medicine, and bodywork, the focus. What I'm saying is the true power comes from the preventative arm, which in Chinese we call yang sheng. Yang means to support or maintain, and sheng means life. Supporting life, maintaining life. Now let's look at this graph, which will really help our understanding here. In the center of the graph you've got no discernible illness or wellness, right? Usually we're using a healthcare system that goes to the left-hand side of the graph here, what we call a disease-orientated approach. Often it's like a disease management system. We get signs and symptoms and we use our healthcare system to come back at best to those no signs and symptoms. Now, this is okay. This is about helping sick people become less sick, which is really important. But my focus here is to help ordinary people like you and I, who are relatively untroubled, how to make us more healthy, happier, more fulfilled, more productive. This is the goal. This is what the ancient sages would have called how to create harmony with the Tao, and let our destinies unfold. So we look at the right-hand side of the graph. We have awareness, education, and growth. This is leading to higher states and higher levels of wellness. And there are three real keys to wellness here. The first key is self-responsibility. Nobody can give you this type of health. You have to do it yourself. They can guide you and you can read things, but you have to implement them yourself, right? A holistic approach, we need to, holistic with an H, comes from the holy, the fully integrated, treating the whole person. The most important sentence here is the whole is greater than the sum of its parts. The third key to wellness, these wellness ideas haven't changed since the 60s and the Woodstock Revolution. Self-responsibility, holistic approach, and what I would call also that's incredibly important is repetitive input, daily discipline. You will achieve superior results with wellness, but you need repetitive input. You need to live these changes, live these implementations for them to benefit you. If you get this daily cycle working with this discipline, and cycles within cycles, the lunar cycle, the seasonal cycle, the annual cycle, your life cycle will start to drop into place. Cycles within cycles. These are the main differences between health and wellness. Until next time. Okay, before we move on, we should really talk about prevention. What are the different types of preventative health and wellness? So before we move on, we'd like to sort of think about what the differences are in Western modern prevention towards ancient Chinese prevention. There are some clear differences here. And what we'll think about is modern healthcare, and the modern health system is really focused on infectious diseases, I feel, too much. We're looking at inoculations and vaccinations, or we're looking at the genome project, or the stem cell research, and we're looking at predicting diseases that people are going to, or destined to receive, and we're going to treat them earlier for results. And look, there is some value in that. But really today's diseases are really much more lifestyle based. And those lifestyle diseases, for example, we can think about are diabetes, endocrine disorders, autoimmune disorders, asthma, skin conditions, mental and emotional problems, gut and digestive disorders. These are all labeled under the heading of lifestyle diseases, right? So it's almost that our disease model of prevention is not really recognizing that humans have choice and decision and a sense of responsibility here. This type of prevention that I'm talking about is not necessarily giving up things, but more about positive interventions, what we can do, not the high-tech, high-cost approach to healthcare that we're talking in prevention. This is a low-tech, low-cost prevention of healthcare based on thousands of years of observation of healthy people that creates a system of how we can become more balanced and aligned, and how we can possibly not only avoid minor problems, but seek towards our inner destiny and be guided by something much larger than ourselves in a spiritual sense. Yeah. You know, the great thing about studying Chinese culture and Chinese medicine is that we have the extant classics, and one of the compulsory texts you study in Chinese medicine is the Huangdi Neijing, the Yellow Emperor's Classic, right? This states, in 300 BCE, right, it states that very clearly, treating disease after it manifests is like digging the well after you're thirsty, is like forging the weapons after the war has begun. So let's see what we can do, and this course is about positive interventions based on Eastern philosophy. Okay, welcome to Ditan Park after a little bit of overnight rain. This is Ditan, the Temple of Earth. Di literally means earth. Tan is more than a temple, it's a place for worship, sure, but Tan is literally a raised platform for worship, where the emperor would come according to the lunar solar calendar. In fact, the second new moon after the winter solstice is what we call the Chinese New Year. He would come here and fast and make offerings on the altar to heaven and earth. As the embodiment of human beings, he also has to humble and say he is nothing compared to the great source and the great power of nature and the universe. Okay. We talked about the preventative ideas and the difference between prevention and prevention. You know, disease-oriented prevention versus positive interventions. And now we're going to talk a little bit about what is out there at the moment in terms of modern wellness solutions and the pros and cons of that. And look, there's some great ideas out there. There's some people that have been working on this since the 60s. And let's have a look at this wellness wheel. And let's have a look from this diagram. We can see that we can start to see the holism idea incorporated into wellness. You know, remember the keys of wellness? We talked about responsibility and choice, yeah? We talked about holistic approach. You can see this in the wheel, right? You can see that your health now is not measured individually by certain aspects. It's actually a part of all these activities or phenomena. And you know, each slice can be measured using a physical test or a psychological test. And then we can determine where you are strong and where you are weak. And most importantly, in a holistic idea, where you are weak, we need to strengthen. So we have activities then, or we assign you a coach who specializes in that area. And you can see how that can really help people and the holistic nature of this idea and bring people up to higher levels of health and wellness. Now, essentially, this is what the Chinese have been thinking for thousands of years. You know, the idea of balance, health and wellness, and the idea that we are a small being between the larger forces of heaven and earth. Like all living systems, between the great polarity of heaven and earth exist all beings, and their goal or their purpose is to merge back with that source. And so balance, health, longevity and mortality are part of that one continuum. Yeah. Before we go into this, we call that the metaphysical ideas of Chinese medicine, and they're assumptions about reality, the idea we're a microcosm of the macrocosm, and there's purpose for us as a small part of a larger natural order to re-emerge and join with that, like a drop in the ocean. Yeah, it's part of the ocean, but it's also its individual self, and it needs to re-emerge with the ocean. Similar idea for human beings, yeah? So, before we go too deeply into this idea, let's have a look more at the Eastern perspective and give you some ideas of how we can see this and how we can incorporate that into our lives and how we can benefit from this perspective. Yeah, great.